Scene 1, Introduction. Welcome to the unit, Provide Individualized Support. In this video, we will cover how to 1. Respect and include the person and their support team. 2. Support choice, control, and decision-making. 3. Maintain privacy and informed consent. 4. Understand and respond correctly to restrictive practices. These are critical training elements and will be demonstrated through realistic workplace simulations. Scene 2, Respect and Inclusion. Under the NDIS Key Legislative Act, which governs the NDIS National Disability Insurance Scheme Act, NDIS Act. The National Disability Insurance Scheme Act, 2013. Under the National Disability Insurance Scheme Act 2013, support planning and delivery must be providing reasonable and necessary individualized supports, directed by the participant, enabling persons with disability to exercise choice and control in pursuit of their goals, respectful of family, carers, and others identified by the person, focused on choice, control, independence, and community participation. As a support worker, you must actively respect and include the person's support team and, where possible, strengthen their capacity to support the person. An approved health practitioner must also have assessed the restrictive practice as necessary. The documentation should included in the participant's individual plan. In the participant's care plan, Scene 3, what respect looks like in practice. Respect is shown through behavior, not just words. You must demonstrate respectful behavior toward the person's goals, needs, and preferences, physical, emotional, social, and psychological well-being, cultural beliefs and diversity, privacy and confidentiality, relationships with family, carers, and friends, rights and dignity. Respect requires conscious and deliberate effort in every interaction. In the case of a chemical restraint, the assessments must be conducted by a medical or nurse practitioner. What are the 5 things that must be documented in the client's individualized plan? Assessment of the client as a risk of harm to themselves or another person. Client's behavior relevant to the need for the chemical restraint. Practitioner's decision to use the chemical restraint. Reasons the chemical restraint is necessary. Information that inform the practitioner's decision. Simulation 1, Respectful Inclusion. Family member raises a concern.
We feel she's becoming overwhelmed during activities.
Thank you for sharing that. I'll discuss this with her and report it so we can review her support plan together.
This demonstrates respect, collaboration, and inclusion of the support team. Scene 4, Supporting Choice, Control, and Dignity of Risk. Supporting a person means helping them make choices and decisions about their own life. Duty of care requires you to act in the person's best interest. Dignity of risk means respecting the person's right to take risks while working to reduce harm. To support decision-making, you should provide clear options and relevant information, use appropriate communication techniques, allow time to decide, use closed questions when too many choices may cause distress, encourage everyday opportunities to make choices. Simulation 2, Supporting Choice Safely.
Would you prefer to stay in today or go to the park? Both options are available.
This supports choice while reducing decision-making stress. Scene 5, Maintaining Privacy and Informed Consent. Maintaining privacy is a legal and ethical requirement. Informed consent means the person understands possible outcomes, risks involved, financial impacts. Consent is required before sharing personal information, except when a court order applies. Law enforcement requires information. There is a risk of serious harm. Clients may withdraw consent at any time. Simulation 3, Gaining Consent.
Before I share this information, I want to explain what it will be used for. Are you happy to give your consent?
This demonstrates lawful and respectful practice. Scene 6, What are restrictive practices? Restrictive practices are any interventions that restrict a person's rights or freedom of movement. Under Australian government definition, any practice or intervention that has the effect of restricting the rights or freedom of movement of a person with disability. They must only be used. As a last resort, be the least restrictive response possible in the circumstances. To prevent harm, reduce the risk of harm to the person or others. In the least restrictive way, be used for the shortest possible time to ensure the safety of the person or others. The 5 types are chemical restraint, environmental restraint, mechanical restraint, physical restraint, seclusion restraint. Scene 7, Requirements for using restrictive practices. The use of restrictive practices is highly regulated. Requirements include alternatives must be tried and documented, included restrictive practices considered and used, why they have not been successful. An approved health practitioner must assess risk. Use must be recorded in the individualized plan. Informed consent must be obtained. Practices must be monitored, reviewed, and reduced as soon as possible. A behavior support plan must be in place. Unauthorized restrictive practices are not permitted. Simulation 4, Correct response to behavior of concern.
Other strategies have not worked. I am reporting this immediately and following the behavior support plan.
This demonstrates correct escalation and legal compliance. Scene 8, Ethical considerations. Before using a restrictive practice, ask, is it demeaning? Does it involve intimidation? Does it deny basic rights? Will it cause further distress? If the answer is yes, the practice may be unethical and must not be used. For assessment, you must demonstrate that you can. Respect and include the support team. Support choice and dignity of risk. Maintain privacy and informed consent. Identify and respond correctly to restrictive practices. Assessors will observe both your actions and decision-making. Please review the restrictive practices section of your learner guide and reflect on how these requirements protect people's rights and safety. Thank you for watching.